This same type of manipulation can be used for the ulnar meniscus, and actually I use this as a replacement for the older manipulation that was basically a little bit hard on the fixing thumb. Treat the meniscus exactly the same way as you would any other carpal. If the meniscus is torn and displaced dorsally, then I need to come in, stabilise the ulna palmally, work your way through the palmar tendons, come onto the meniscus, apply your traction and thrust the meniscus down. If this happened to be a palmar subluxation, then we'll fix the anterior aspect of the meniscus as best we can, come onto the dorsum of the ulna, traction and thrust the ulna downwards. Again, if you note, the wrist was maintained in this neutral position. The problem that people have is using their arms and their body when they do this rather than their wrist. And this is what you really have to practice, is this downward movement and a final little thrust with the thumb on the manipulation, okay? And not doing this type of thing. Because all you'll do is jam the joint surfaces together and make matters worse. Just a word about this area. The wrist joint is very prone to instability, and in fact patients who have wrist joint problems tend not to get over them. One of the things you want to really think about after doing one of these manipulations is testing for stability, and we looked at that in previous tapes where you just check the mobility in the close packed position. If you find that it's moving and clicking, one of the things you can do is frictions to the posterior capsule, and you do that with a pencil and an eraser, and basically you just find the tender area and you friction it like so, and you can instruct the patient to do it. Hopefully what you're doing here is producing enough trauma over a small enough area that you'll promote the growth of scar tissue, which will help tighten this area up. Otherwise, if this is truly seriously unstable, the only thing the patient can do is wear a wrist support to stop this from going into the extremes of range. Okay.